Remember the last video we shared about what physiotherapists can do to foreign shoulder conditions? Now, my name is Michael and this is Lifeng.
Hello.
We are from Balance Core and we would like to share with you what you as a sufferer of the foreign shoulder can help yourself at home.
All right, we'll start by looking at a few exercises that are commonly done, which I believe to be actually helping, but actually are not. Let's get Michael to be sitting up here. So the first one would be what we call crawl up the wall. So imagine there's a wall in front of Michael. So what most people do would be putting hands on the wall and try to actually climb higher and higher with the arm. So in this case, what happens is appears to be the hand is getting higher, but it doesn't really mean the shoulder is getting more flexible, because that movement, that going up movement, can be produced by a few things, not by the shoulder, rather by what we call the shoulder blade going, just lifting excessively, or even arching the back excessively to get the arm or the hand higher. So that's the first myth. So that actually doesn't really make the shoulder more flexible, the one they want to work on, but rather other parts to work excessively. The second one would be, well, something like what we call hand behind the back. Okay, with frozen shoulder, what happens is people feel difficult to get hands up higher towards the back. So what they do is they try to actually use a lot of strength to pull the arm as high as they can. And again, it appears to be that sometimes the hand does get higher, but again, that may not be actually mobilizing the joint we need to. So this could be actually done or achieved by, again, tilting the shoulder forward, the shoulder blade forward excessively, or actually hunching too much forward to just make the arm appears to be going higher. Now, we'll be looking at a few exercises that can really help to improve the mobility of shoulder. We'll start with sitting in front of a table, probably a table of dining table height. Then would be resting our elbows on the table. So what we're trying to do is to improve the mobility of the shoulder over here. And instead of lifting the arm, we'll try to move the body backwards. So we'll get Michael to demonstrate. So here with, okay, this chair has wheels, so it's easy. So pretty much get Michael to kind of gently push with his legs and slide the chair backwards while relaxing the shoulder. So while the body moves backwards, that gives a stretch to the shoulder you want to work on. And remember, this is supposed to be done by using your legs, so no lifting of the arm is needed. And you just have to relax and push with the legs gently to the point you feel stretched. And you can probably stay there for up to about a minute. And a good way to count the time is you can actually focus on your breathing. So each breath in and out will take probably about 6 to 8 seconds. So you can count up to about 10 breaths and then slowly recover to the beginning position. And usually after a stretch like that intensity, the arm will be a little sore. So you probably need to rest for about a minute and then repeat the same thing again. And let's go again. Yeah, same thing, we'll get to the point it starts to feel stretched. And just count your breathing up to about 10 breaths and go back to starting position again. Yeah, you can usually repeat this up to about 3 repetitions. Just now, that stretch helped getting the arm higher to the front. Now we'll look at another similar exercise that can help actually get higher to the side, as if you're getting the arm higher this way. So same thing, we're not going to use the arm to lift. We're going to use the body to help. So again, we'll be probably sitting next. We'll be sitting next to a dining table. If you think the height needs to be higher here, you can also use something to support you, like a pillow, or maybe just like books or anything that can help you increase the height of the shoulder bit. And what you can do is, again, we're not going to use arm muscle to work. We just move the body to the side. Again, to the point you feel there's some stretch there, then you can stay there and again, probably hold that stretch for about a minute. Same thing in this position, you want to make sure that you are completely relaxed. The shoulder is low, kind of like what we call away from the ear on the same side, and there are no muscles trying to lift or anything. And then, of course, after about a minute, we recover to the starting position. And again, you can rest for about a minute and repeat the same thing again for another 2 to 3 repetitions.
The next 2 exercises are done in the bed. What happened is, Lifeng, can you help me to lie down? The injured side or the painful side should be below and the position away from the ear, and the elbow should be near to the edge of the bed. Okay, and now you make the elbow to the height, to the higher level that's nearer to the head, just short of the pain. Then what you do is hold on to your wrist by here, and we can stretch the back portion of the shoulder by pulling this wrist slowly downwards. Okay, once you feel that, hey, there's discomfort going on in the shoulder joint, and you can pause there for a while and take deep breath in and out slowly, about 1 minute, which usually takes about 10 breaths. And during this process, if you do feel that, hey, your finger, your wrist able to go down slowly, you can maintain the pressure there. After 1 minute, you can slowly let go and take a break for another 1 minute. Then when your pain is completely free, you can do this for the second time. We like to repeat the same process for the next 3 more times, so that you can feel that the joint is getting loosened up more and the wrist is slowly moving closer to the bed. After this direction, now the next one is basically same positioning with the hand going towards the pillow. So your hand can be here, just slowly lower down until you feel the barrier where the discomfort is coming at the shoulder. You stop there for a while and breathe naturally. In and out for another 10 rounds. That's about 1 minute. You can slowly come back and rest for 1 minute. We repeat this same process another 2 or 3 more times. This is for the purpose of loosening the deep fascia within the shoulder area that helps us to move freely. There's one more exercise I would like you to do for the purpose of releasing the tension that's within the arm. A lot of people who have frozen shoulder condition, not only they get pain around the shoulder, but the pain is also extending down to the arm that restrict the movement as well. So we like to loosen up the muscle over here. So important thing is, Lifeng, can I get you to reach the hand behind the back until the limit that your pain sets in. For example, it's over here, then his hand can be here while the other hand come over to grab the wrist. Okay, and that's his limit over here currently. The usual tightness is felt around the arm over here. It is important for Lifeng, do not hunch back, do not tense your body, just breathe naturally and gently pull the wrist towards the center of the pelvis, or if you can pass that, pull towards up along the spine until you feel that's the limit of yourself. There's a moderate discomfort on the 0 to 10 scale, about 5 out of 10. And what you need to do is just continue to take deep breath in and out, and every time you're breathing out, you imagine your muscle can be more relaxed and your hand can slowly move up a little more. Okay, but do not force it. The critical thing about this type of stretches, as well as any other stretches, is about relaxing yourself. Go with the flow. Don't try to push it as hard as you can. Not necessarily. You just push for moderate discomfort and let the muscle gradually relax and the fascia gradually give way. then you will find a slow progression in the improvement of range of motion. If you do that daily basis, you get little better and better every day. So that was our little video showing you some of the important exercises to improve your frozen shoulder condition. And I would like you to share with us a journey with frozen shoulder down in the comments below.
If you found our contents useful, please like, follow, and subscribe on our YouTube, Facebook, and Instagram. And we'll see you at our next video.
Thank you.